So the Ngāti Porou order got cracking. With Connie coordinating the local agencies, they compiled all the research and survey material they needed to present to council.
We did it as a survey, questionnaire we pumped out into the community. It asked that, have you got a gambling problem? And do you know somebody who's got a gambling problem? Is there a whānau with a gambling problem? Have you ever experienced a gambling problem, whatever, whether you were one or were you just a whānau member? So out of all the surveys, 82% had some experience with gambling problem.
They canvassed hundreds of people with questionnaires, phone interviews and visits. They kept the media informed and collected every news clipping.
Connie, with the backing of Bill, did put out surveys all around the district, followed them up, got a really good response rate, and were able to come up with a big set of statistics that showed there really were problems being caused to individuals and families and whānau all over the district by gambling on pokie machines. And that research was good enough and strong enough that they were able to put it back to council, and we said to council, look, this research is good, it's solid, you can't argue with it, you need to have the review that you promised.
The survey done by Ngāti Porou Hauora identified 82% of those polled had been negatively affected by gambling.
It was information about the numbers of people that problem gambling was affecting, and then it was from pokie machines, and then relating that to that national and international information, so that it had a very definite local focus.
And the council agreed, and they said, right, we will have another round of submissions and we'll look at our policy and see if it needs changing.
The hearing committee agreed to review the policy. That's when we all got together.
We also started to bring in other groups from the community, a whole range of groups, Gisborne Council of Social Services, Pacific Island groups, and lots of other groups in the community. Public health unit from the hospital, all came together and we started to work together.
The local agencies, and in particular Ngāti Porou as the iwi, drew together the local strengths. We were able to add to that by having a local person who could tap into our research and library and researchers and bring in the national statistics, the national picture, help people interpret and analyse the data on the ground.
We started to talk with each other, we started to kind of coordinate our efforts in writing submissions. Instead of writing one submission, every individual organisation within our costs were asked to put a proposal and a submission in too.
When we go into the council, we're 30 against 2.
And so when you got 32 organisations all putting in a proposal, a submission to council, the council's got to listen.
We're outnumbered. We outnumber them by heaps, and for us we've got to keep that going.
Coming as a group, your voice has got more impact, and of course working together as a group with the various organisations in Gisborne about this issue of problem gambling and making changes in the policies, of course it would have more impact.
So all those issues here are coming forth from all the agencies so they could understand why we wanted, all of us wanted a sinking lid policy. Another
strength is relationships. Relationships are very important with the community organisations, but also with council.
We had a huge networking system already in place, so what we did was bring them on board.
We're able to network very quickly and very passionately.
They had the same sort of ideals in the areas of problem gambling. They saw the consequences of problem gambling in our area.
It sounds as if myself and my department have done a great deal in this. Really we haven't. These groups have really done the hard yards and gone out there and researched the problem and come back with all the information. Really all we've done is just facilitate and advocate.
We had 2 rounds of submissions, and in that we put together the local information that Ngāti Porou had come up with, plus national statistics that I could bring access through Problem Gambling Foundation, international research. We put the whole package together.
We had local data, but we didn't have national data. We couldn't weave it into our local data, so Dave was a big asset to us in the areas of bringing local data into